Hello, this is Dr. Gay from First Lake MRI, and this is a 56-year-old female who fell skiing recently, has pain in her thumb, and she has a classic example of a Stener lesion. So I've showed several of these, and this is just a nice example. And she also has an injury of one of her thenar muscles. So this is the thumb here. This is the distal phalanx. This is the proximal phalanx of the thumb, and this is the first metacarpal bone. This is the metacarpal head. And we just happen to notice there's a little splotch of brightness right here in the base of this distal phalanx of the thumb. This is probably a little benign enchondroma. Could be a little traumatic bone lesion, but this is definitely incidental, but you may have noticed that. The real money is down here. So this is the ulnar collateral ligament is on this side. This is the radial collateral ligament. This is the first metacarpal phalangeal joint. This is the first metacarpal bone. Proximal phalanx, so they call this the metacarpal phalangeal joint, or the MCP for short. And there's an ulnar collateral ligament that we should see coming across here. It should be a dark black line, and instead of seeing the dark black line, we see the little small dark line right there. And if we follow this dark line backwards towards the central part, we see there's a muscle here with a little black line. That's a central tendon, and that central tendon comes across here. And that's what that is. And that comes over here to attach over on the base of this bone. We can see that this has pulled off. There's a little bright spot there. There's a little avulsion injury in the base of that proximal phalanx right where this is. And this is the adductor aponeurosis, a broad ligament that comes off this adductor pollicis muscle. This is the muscle belly here. There's a little black line that's a central tendon. And then it broadens out into this aponeurosis that attaches over here, and so that is intact, but there's edema in the muscle, so a muscle strain. But of note is the ulnar collateral ligament. We're supposed to see the UCL here, but instead we see this aponeurosis, and the UCL is right here. It's horizontally oriented. It should be longitudinally oriented, but the UCL has torn and fallen back down here. It's sideways now instead of longitudinal. And this is in the way, so this UCL cannot attach back here where it wants to attach because this is in the way. And when this happens, when this is ruptured and pulled away and this gets in between where this has no ability to heal, they call this a Stener lesion. This is something that will require surgery. They need to move this out of the way. They need to take this UCL back up here and attach it down here. And this is something very important to be able to notice and describe for the surgeon. This is, again, that horizontal band is part of that ulnar collateral ligament that's torn and peeled back. On this side is the radial collateral ligament. We see there's darkness over here. It may have a mild strain, but it's not ruptured, not torn. The patient also had one other finding, which is over here on the other side. We have, on this one view here, on this deep part, we have the adductor, ADD, adductor pollicis muscle and tendon. On the very superficial side, the opposite side, we have the abductor, ABD abductor over here. So the inner and outer side, this is abducting, this is adducting the thumb. And then deep to the abductor, we have the flexor muscle here. This is the flexor pollicis brevis muscle. There's a little bit of fluid in there. If we look on this view, we'll see that better. This is an axial image, and we're going to look in the thenar muscles. These are the thenar muscles of the thumb. This is the thumb. This is along the palm here. And these are the thenar muscles, hypothenar muscles. Here are the metacarpal bones. This is the first, second, third, fourth, fifth. And we see this bright spot here. This is a little bit of edema or hemorrhage right within that torn flexor pollicis brevis muscle. The superficial one here is the abductor pollicis, and the one right deep to it is that flexor pollicis. So a torn flexor pollicis brevis muscle with a hemorrhage or edema within the muscle tear. You also have a little bone injury here. It could be a bone contusion or a little subtle cortical avulsion injury. And those are the findings. Thank you very much.